This is our Vidant Health Spotlight, and we've got Ashley Elks, who is the Stroke Center Manager at Vidant Medical Center. She's been there 5 years, and Jordan Joyner, who is a Stroke Nurse Navigator. We're going to find out what those things mean right now. May is National Stroke Awareness Month, and Vidant Medical Center has a tremendous stroke team. And, of course, stroke is one of the leading causes of death in North Carolina. So let's talk about that. Ashley, tell us about your job as the stroke manager?
So I'm really lucky because I have a really great team. I have stroke coordinators, I have a stroke nurse navigator, I have a stroke nurse specialist, and we basically work really hard to ensure that we are providing the best care within the Vidant Health system for our stroke patients. So I kind of just help oversee that program and that process.
You know, when the Heart Center was built a few years ago, we kind of kicked up our coverage, didn't we? It's there's no place to have a no great place to have a stroke, but Eastern North Carolina has been known for years as the stroke belt. Have we not?
Right.
And so having that Heart and Stroke Center built here was really huge. And, I always sing the praises of Vidant Health, but I had another experience there last week. And every time I come away from Vidant Health, I just, I just praise the Lord that we have such an incredible medical facility here in our community.
Yeah, we certainly, well, I mean, we're a little biased, but we do love Vidant Medical Center. I've been a patient there. I've had loved ones that were treated there. And if I ever were to have a stroke, which I hope I don't, I would feel confident in receiving treatment there. And not just at Vidant Medical Center, but any of the Vidant Health hospitals. We've implemented a new program called Telestroke within Vidant Health, which is this really neat, high technology program where any patient can go into a Vidant Health facility and they literally have a robot stationed in the ED, and it will roll up to that patient, and instantly they are connected with a neurologist at Wake Forest Baptist.
No kidding.
And Wake Forest Baptist physicians can assess the patient with the help of the bedside nurse via that robot and collaborate with that physician to make decisions on how they should treat that patient.
Unbelievable.
So it's really exciting. We just went live with that in February at 3 hospitals, and the other 3 came up in May.
Wow.
So it's really exciting times.
No kidding. That's really interesting. Now, Jordan Joyner, Stroke Nurse Navigator. Jordan, tell us what your job is.
Certainly. So the Stroke Nurse Navigator is a new concept in not only the Stroke Center, but Vidant Medical Center in general. And so because stroke is the number one disabler, and it really does take a team to work with these patients. It's a lot on the caregivers. It's a lot of care to navigate. You've got physical therapy, occupational therapy, speech therapy. So the navigator is someone that can help patients and families walk through the plan of care. Someone that can meet them on day 1 and then follow them even after discharge. So not only helping to coordinate care, but providing a lot of emotional support, whatever the needs may be, education, things like that. And then I'm also doing a lot of community outreach events. So getting the opportunity to be in our community and help people with how they can prevent a stroke. Because a lot of the risk factors are things that we can change with lifestyle changes or medications. So it's great. I'm enjoying it.
So let's talk about how to avoid having a stroke.
Yeah.
A lot of it is genetics, I guess. A lot of it is lifestyle, but there's a lot of things some things we can't control, but there are a lot of things we can control, right?
Right,
So
right.
Ashley, tell us about some of those.
So 80% of strokes are preventable.
No kidding.
Yes, which is a lot. A lot of people don't know that, but a lot of it is blood pressure modification, exercise, keeping your weight down, not smoking. I mean, those are probably, I would think, the biggest things that we have control over in our day-to-day life. Not only for stroke, but heart disease and diabetes. I mean, they all kind of fall under the same
Together.
body. So those are some things that we'd really like people to focus on. And I think the message that's really important for us to send to people is that if they do have any signs and symptoms at home that they're having a stroke, if they are having any facial droop or they're drooling out of one side of their mouth, they can't hold one of their arms up, there's a lot of numbness and tingling. If they're having trouble with word finding, some people can't speak at all, a bad headache, Those are all signs and symptoms that you need to get to the hospital like right away. Don't drive yourself. Call 911
Yes.
and get to the hospital.
Yeah.
Because treating the acute stroke patient, it's a very time-sensitive procedure. I mean, that you only have so many hours after you've had signs and symptoms of a stroke that we can treat you. So it's really important for people to get to the hospital as soon as possible.
Beyond your lifestyle choices to avoid a stroke, would you say, make sure that you know what your blood pressure numbers are?
I think that's very important.
Yeah.
I mean, it's important to know what's normal for your body.
Yeah.
And everybody is different. So there's the textbook answer of what a normal blood pressure is, but my blood pressure compared to Jordan's blood pressure is going to be a lot different, but that's okay for us as individuals. But we do know that patients who have prolonged episodes of high blood pressure are at much higher risk for having a stroke.
And when you put blood pressure combined with the lifestyle choice of tobacco, you're making a combination that is extremely, extremely high risk.
Yeah. All right. So is there somewhere to go get more information about Stroke Awareness Month? Something on the website or something? Or just come to your event on Saturday?
Well, that would be great.
Yeah.
I'd love to see you.
We'd love to talk to you face to face. There is at the Vidant Health website, you can Google basically stroke at Vidant Health, and you can get a lot of great information on that website. Or reach out to us.
Yeah. Well, you guys do a great job. I really sincerely mean this. If you have an experience at Vidant, and you come away really feeling like people really care about you, and it's usually if you're there, it's usually one of the low points of your life. So you want people to care, and I just always come away feeling like people do. So I think you have an incredible spirit and attitude at Vidant Health, and we appreciate everything that you do.
Well, thank you.
you.
We
We're
appreciate
very
y'all.
fortunate to have Vidant Health in this community, and we're fortunate to have you guys. Thanks for what you do.
Thank you.
Nice-
Thanks for
So
having
welcome.
us.
Thank
Nice to meet you both. Ashley Elks, the Stroke Center Manager for Vidant Medical, and Jordan Joyner, the Stroke Nurse Navigator.